Function with the Business Committee, the Speaker has given leave to Emma Sheeran to raise the matter of domiciliary care packages in the Northern Health and Social Care Trust. I call Emma Sheeran. You have up to 15 minutes.
Thank you, Mr Deputy Speaker, and thank you to the Minister for joining us here this afternoon for this really important debate. I want to congratulate you on your new role, and I also want to wish you the very best of luck. You have a mammoth task ahead of you, and I know you don't take that lightly, and obviously your experience in the role before, and I appreciate that all parties have stated very clearly that they want to work together to fix our health service, and that's something that I have a strong commitment to in my role, because we can make no mistake about it, our health service is in crisis. And the issue that I'm bringing to you this afternoon is something that I know you'll recall I have spoken to you about on countless occasions before, and it's something that is very close to my heart because, Minister, our domiciliary care provision in the Northern Trust is in crisis. Our respite services are in crisis, and the situation for our unpaid carers at home is that they are in crisis. You will probably be aware that as of November last year, a report concluded that there were over 1,700 people in the Northern Trust waiting on a full or partial package of care. That's an area that covers from Coleraine to Galway. 1,700 people, that's a massive number. But in reality, that is only the tip of the iceberg, because each of these individuals have families, friends, neighbours, loved ones who are just as impacted by their situation as they are. And of those 1,700 people, there will be a portion of them who are stuck in hospital, in a clinical bed that they no longer need to be in because they have received the medical attention that they need, but they can't leave the bed because it's not safe for them to return home without a package of care. And therefore they are taking up space in a hospital bed, and that is adding to the pressure on both themselves and their family who want them to be home again. There are a cohort of those people who, feeling pressurised from the Trust and feeling pressure to free up that bed, then agree to take a step-down bed in a nursing home facility. And the nursing homes that we have across the north are fantastic. The staff who work there are brilliant. But the reality is that for an awful lot of people, they are just not the appropriate placement for these individuals, particularly in an area like the one I represent in Mid-Ulster, with a massive rural population, people who had very independent, busy lives, who like seeing green fields outside them. They don't want to be in a nursing home. They want to be in the environment that they're used to and in their own home that they're comfortable with. And then you have the third cohort of those 1,700 people, and that's people who are at home but are not fit to be at home without a package of care. People who perhaps have had a spell of illness, went into hospital and returned home before they really should have, or people that haven't had to quite go to hospital but whose health have deteriorated, and as a result they're not able to manage their homes the way that they were, and their families, without any experience, any training, any expertise in caring, become their carers because they feel obligated to. That leaves those people feeling pressurised to carry out that role, and the person themselves feeling like they're an inconvenience, like a burden, and everybody is unhappy. And as a constituency MLA, this is something that is brought to me every week, and families at their wits' ends. People run ragged. You have families, groups of siblings in their 30s, 40s, 50s, who have, up until this point, had very happy lives, all got on with each other, had great relationships, came together to celebrate occasions, and suddenly they're not deciding on a Tuesday evening, God, there's a shower of rain, I'm not going to go for a run tonight, I'll go and get a bag of goodies and call in my mummy and sit for an hour and crack. Instead, there's a rota. They have to be there at a set time. They have to leave to let somebody else in for their set time, and then somebody's son is going on a school trip and they have to leave them to the airport, and suddenly they're not able to fill their slot, somebody else has to fill in for them. And you have this situation where people are at each other's throats, there's resentment, there's bickering. I've seen this in my own extended family. My two grandparents on my mother's side, we were lucky to have them at home until they passed away, and the family stepped up and everybody did what they had to do, but it was always there under the surface. People, this niggling annoyance that somebody wasn't doing what they should have been and somebody else was taking on more than their fair share of the responsibility. And it is heartbreaking when people ring you with their stories and they're asking you for help, and the answer that I'm telling them is, I don't know when I'm going to be able to secure that care package for you. I don't know. How long is a piece of string? And the reality in rural situations an awful lot of the time is that you're waiting for somebody in the locality to pass away for that care package to become freed up. And it's a terrible situation for everybody involved. I'm not trying to exaggerate the situation or to prey on anyone's emotions, but in the past week, I have had 2 families contact me for whom I was working to try and secure care packages where the people have passed away before their care packages were delivered. And that's not a conversation I want to ever have again. It's not a nice situation to be in. I commend everyone within the Trust. I am dealing with our local managers all the time. I'm a torture, I know that. I'm contacting them all the time about this. But it's really, really frustrating. And in a rural area, we know that this disproportionately impacts women because invariably women take on the majority of the caring burden within the home. The vast majority of people who contact me will be the daughters-in-law, the nieces, the sisters, the wives. It disproportionately impacts rural dwellers as well, because an awful lot of the time somebody that lives 4 or 5 or 6 miles out of the town is not going to be able to get that care package because the agencies and the Trust staff can't afford to carry out that visit because it's costing money to carry out that visit. And that leaves families in a really terrible situation. And it's the exact same in terms of respite services. We have families with children with very challenging needs. I know that the Rainbow Lodge has been closed since May of last year. That leaves those people without provision. We have Hollybank in the constituency as well, where they've had to reduce their capacity in order to try and provide services for people with very complex, very challenging behaviours, but that leaves the people who were previously relying on the service unable to do so. And I had one family in contact with me recently who in the past had a situation whereby every year they would receive a calendar at the beginning of the year. They were going to get 6 days over the course of the year. 2 or 3 of them would be for a week. The rest would be 4 or 5 day-long stays. They were able to plan a breakaway, a holiday, go away, completely relax, switch off, know that their loved one was being cared for in an environment that was suitable for them, and have that peace of mind. Now their stays have been reduced. They're 3 nights maximum. They're maybe 4 or 5 over the course of the year if they're lucky, and they're on an ad hoc basis. So there's no forward planning. There's no knowing when they're going to have that break. The mental health of these carers and these people who have been put into this position and forced to take on a responsibility that they're not equipped fully to carry on is the mental health impact is massive. And as well as dealing with the already very daunting experience of having a loved one who has had a life-changing illness, or maybe received a diagnosis of dementia, or went through an accident that has completely reduced or removed all their mobility, and the emotional impact of that, of seeing somebody becoming a shell of who they formerly were, you've also got the burden that now you're their carer. And sometimes in conversations with people from the Trust, they'll say to me about the carer's assessment, and the family have to step up and the family have to provide us with detail of when they're going to be there. And family time is so important. But the family time is not quality family time, because you're not there having a conversation with your loved one or spending time with them in the way that you previously would. You are now responsible for keeping that person alive. And the burden that is for people, particularly people with no caring background, is huge. So I'm raising this, and I know I've raised this with you before, Minister, and what I suppose we want to see is a plan in place. The carers, the people who have done this job, and again, I know lots of them personally, and you'll find that people that have done this work for any amount of time, their clients become friends. They're going at Christmas time buying them presents. They're calling in even when they're not supposed to be there, because they care about the people, they have a relationship with these families, and they want to see them happy and content. These people need to be treated fairly. They need to be paid better. Their work, which is a vocation and which is skilled work, needs to be recognised as such. We need to see them having their mileage covered so that we can afford to get those more remote calls facilitated. We want to see a plan in place which is going to allow for recruitment and retain those staff in the area. And I know I've met with Jennifer Welsh and the staff within the Northern Trust on regular occasions. We always discuss this, and I know they want to work with you to do that. So I appreciate you taking the time to listen to this, and I hope we're going to see some movement for all of those people who are affected. Gormagan.
Although more members of the chamber should please indicate if you do wish to speak. I call Keith Buchanan.
Thank you, Mr. Deputy Speaker, and I congratulate you in your new role. You're looking well in that chair, I must admit. And also congratulate the Minister for his stay of absence, and then he's back on the chair again, so I wish him well as well. I'd like to start by thanking the member for raising this important issue of domiciliary care packages in the Northern Health and Social Care Trust. I have first-hand experience of the work that these teams do, as my own mother in her 91st year is being looked after by two ladies and sometimes gentlemen at time and time abouts. They do an excellent job in a very professional manner. She's cared for like an egg. I wouldn't put that, she's not watching this on social media, and please don't tell her that, but she's looked after like an egg, to be honest. And I had the privilege this morning of doing the medication run first thing before I come here. So she's doing well, but it is vital. I think the points the member raised is vitally important. The 7 of us as a family, and the pressure that puts on you if we hadn't those care packages, you know, that takes the entire pressure out of it. We can fill in the gaps and do a bit around it all, but you couldn't do it all. Everybody has busy lives in every household. So it's a very valid point. Sometimes harmonious families can be at others' throats within 3 to 4 months after, you know, an elderly person or any person needing that kind of care. It can put a lot of strain on, so it's a very valid point. Constituents and their families who are waiting for a package of care contact my office on a weekly basis, as the other contributor had mentioned. Some are in hospital while others are already back in their own homes and waiting for the necessary package. Every individual patient has different care needs. Many want to continue to have some independence and want to live in their own home as long as possible with the much needed supportive care in the home. To do this, they need practical support with daily living tasks such as personal care and preparing food, etc. Some need adaptations to their homes to ensure they can continue to live as independently as possible and without needing residential or nursing home care. The lack of domiciliary care packages means patients who are medically fit to be discharged are remaining in hospital beds or in other facilities, as previously mentioned. This is a knock-on effect on our emergency departments and the number of inpatient beds currently available. I note that in an answer to a priority question to the Minister back on the 5th of February, just last week, that the Trust responded by saying the Trust has reviewed the systems within their in-house home care services to improve efficiency and deliver a higher level of face-to-face time with service users, and that the Northern Trust have contracts with 22 independent sector providers, which includes 3 new providers who signed contracts in the last year. I also welcome the confirmation that the Trust has commenced a contract with a new provider in the Ulster area, and I hope, not their words, not mine, this will alleviate some of the problems regarding outstanding packages of care, and obviously we will see the outworkings of that if that is the case. No doubt it is the case, but we'll see the outworkings of that. So the challenges previously mentioned, obviously what Ulster said is a very rural area. We know we have a growing older population. The average age is increasing faster, and this has implications for health service providers. The longer distances and higher travel costs have implications for providers of domiciliary care, and delivering community-based care can be more expensive, especially in rural areas. It can be more difficult to recruit home care professionals, and travel allowances are not as generous as in other industries. All health trusts have waiting lists for home care, but if it is a concern, on the 25th of January 2024, in a presentation to the Ulster District Council, these are the same figures that the previous speaker had mentioned, Jennifer Welsh, the Chief Executive, revealed that 1,700 people were currently waiting in the community for some element of a care package. And then, in addition to that, Brian Beattie, Director of Adult Services in the Southern Trust, I know we're talking about the Northern, but to give some context, advised was 700 plus were currently waiting, although this was a decrease of 100, approximately 100 compared to December 2023. So it gives some reflection on the Trust. Appreciate their different sizes, but gives some indication of that large 1,700 number. While I acknowledge not all these patients reside in Mid-Ulster, it gives an overview of the level of waiting across both trusts. Some families are offered direct payments, and this may work for some who have a neighbour, friend or relative able to do the work, but it is not always possible for a family to actually find someone able to do this type of work and suit them for only a small amount of time within the day, and to cover the 7 days can be often a challenge. It can work for some, and it would be interesting to know if the Minister may have the detail regarding what percentages of care is carried out through direct payments, if he does have that information, and maybe he does not. But it would be interesting to note how much or many families take that up. So, to summarise, I call on the Health Minister to implement the necessary reforms that will tackle the underlying issues with these care packages, and look forward to his response. Our healthcare workers, including our domiciliary care workers, need the support and changes to address the current situation. Thank you, Mr. Deputy Speaker.
Gurmagad lascan colia agus muisha leis an Waltor sucht an Wallushaw her Osar Gordon. Thanks very much, Mr. Deputy Speaker, and I thank the proposer of the motion for bringing this issue before us today. I don't know many times I've stood in this chamber and raised this very issue, often with the I would almost say the new minister, but often with the minister. But seriously, before I get into the real detail of this, the real vital heroes, and I use the word vital heroes in this, are those domiciliary care workers who, day and night, in good weather and bad, uphill and down dale, in rural areas, are delivering that care to people who essentially need it. They are the real heroes, and I'll come to the point later on. They're the ones who require the recognition, because they do a sterling job. Not only do they provide a service in houses, but in some cases, they're the only people that person, that disabled elderly person, often elderly person, sees. They bring a breath of fresh air into the house, and as the member said, often do things that there's no requirement for them to do. They become family friends. So those staff are essentially vocational workers, because pay and conditions are so much better in many other sectors. It's their dedication and commitment that ensures many people do get the care they need in their own homes. As MLA for Mid-Ulster, I'm very aware of the problems in providing those domiciliary care packages within the Northern Trust area. My office is contacted regularly on basis by patients themselves, still waiting for care packages, by their family members. Yesterday, 3 cases alone around this, the availability of domiciliary care packages. And those are either people waiting for discharge from hospital or have been discharged without the required care packages being available. Indeed, there can be delays in making an assessment of the required help, and even when those assessments have been made, there can be delays in putting together, lengthy delays, I have to say, in putting together the required packages. Now, one trust, thankfully it's not the Northern Trust, I have seen people discharged from hospital without being assessed. Now, that adds to a further problem. The problem is particularly acute in rural areas. It is often the case that there are simply not enough home care workers available, and in some areas to meet the actual demand. Now, it is fact, and I've seen this recently, that a person has to die for another person to get the required domiciliary care package that they've been waiting on for so long. If a care worker goes off either sick or, say for example, as a case I know, on maternity leave, there is no one to replace them on the rota that they are covering, or have been covering. No one to replace them. And people are contacting themselves, what can we do about this? There isn't anybody to replace them. That is just, yes, it's a management issue, it certainly is. But if you don't pay people, you can't expect to get them. If you don't pay them a decent wage, you can't expect to get them. Where they are available, they can be limited in how far they can travel, because, and this is another aspect of it, the terms and conditions are good for the trust insofar as that can be, but for some of the what are referred to as independent sector, that's the private sector, that's another code for the private sector, the terms and conditions aren't appropriate either to have people pay them what they're due for travelling. It isn't just a problem of shortage of home care workers. There have been delays and are delays in the assessment by occupational therapists for the need of aids in the home, adaptations in the home, people with mobility needs. And that's exacerbating the situation within the home. So therefore, whenever the assessment's done, it should be, the theory goes, it should be an all-round assessment. What needs are required, whether those are adaptations to the bathroom, adaptations to the bedroom, it can be other adaptations out around the house, which helps the situation and eases the situation for the person concerned. That isn't happening in a coordinated fashion. So therefore, if someone is disabled, often profoundly disabled, and those aids aren't being provided within the home, that makes it more difficult for the care workers whenever they come in to carry out and fulfil their duties. So it isn't just domiciliary care packages and delivery of same. The Trust have been forced to use step-down beds or interim care placements until domiciliary care packages are available to free up acute hospital beds. And it's important to note, this also is an important issue, that in to provide domiciliary care packages, the issue of putting people into step-down beds or beds in nursing homes can, in actual fact, be more expensive. So there are many other issues we could talk about here. I'm sure we could talk about them with the Minister in depth, but I'm sure he gets the gist of it, being a constituency worker himself, of the problems. Pay people decent wage, proper career structure, and we'll be able to help deliver the service necessary in our communities.
I call Linda Dillon.
Congratulations on your new role, and I was remiss earlier and didn't congratulate the Minister on his new old role. Didn't want to say new old Minister in case people would think that was a personal reference, so congratulations. So I'm not going to go over the points that have already been made. I'm also a representative for the constituency of Mid-Ulster, and the Northern Trust falls into my area. But more importantly, part of my area falls between the Northern and Southern Trust, and that's where real complications happen. Actually, two parts of it fall between Northern and Southern Trust, and we have had families who are being sent from one trust to another and told that you're their responsibility or you're their responsibility, and that is unacceptable. But in the end of the day, no matter which trust it is, very often they cannot get any domiciliary care package, and that is because they are both extremely rural areas. We know that overwhelmingly the people who work in this sector are women of a certain age, and they are being left with health problems themselves because they are taking on more work than they should. They are not getting, as has already been alluded to, the proper pay. They are not being afforded the proper working conditions. So for me, this is a focus. I think that we really need to have a proper plan in place. I know from meetings that I've done with the Permanent Secretary before the Assembly went back up that there is going to be an ask, I hope, coming forward from the Department for decent pay structure and decent working conditions for the staff that work in this sector, and rightly so. I don't need to repeat, as I say, the points that have already been made. These are the staff that went into homes during COVID and didn't abandon the people that they were looking after and put themselves and their own families at risk. And with very little thanks from the rest of the world or community, they just had to get on with it. But the people who they went into were grateful, and the families were grateful, because that was their lifeline. That kept their people at home, it kept them safe, it kept the families safe, it kept them able to be able to function as a family. So I think that, we really do need to have that recognition. But in terms of where we are now, the workforce is not there. I do not see a multitude of young people coming into this line of work. So it's not just about pay, it is about, and I think it has already been mentioned, what progression can be made in this sector for young people, because nobody wants to go into any job thinking this is it. I have no possibility of progression, I have no possibility for further training, for just learning more about how I look after the people that I have to look after. So it's not about having high-flying jobs, but it is about being the best at what you do. And a lot of these people are, but it's not because of the training they're getting, it's because they themselves have their own wish to be the best they can be. They're not getting the training, they're not getting the additional support. So I think that that is also an issue that we need to focus on. As I say, I hope that the department will take this issue seriously. It falls outside the Northern Trust specifically, but I did visit the A&E in Craigavon Area Hospital. Many of the patients will have come from the Northern Trust, and there were 68 people on trolleys in the A&E, and there were 62 people on the wards that were medically able to be discharged but they did not have domiciliary care packages or anywhere to go. So, it really is important. That is the impact. That's the knock-on effect. So people we know are dying in our A&Es, and they're dying because we can't get people who are fit to be discharged. People who are fit to be discharged are dying because we know, particularly the older population and particularly those with dementia, become more ill the longer they're in hospital. So after a person spends 10 days in hospital, they deteriorate. So for me, this has to be a focus. This is about saving lives, and it is about giving people a better quality of life. That is the people that they serve and the staff that work in that sector. I'm not going to repeat all of the points that the other people have made. I think that the Minister has enough to respond to in this.
Now they call Danny Donnelly.
Mr Deputy Speaker, and again I would like to congratulate you on your new role. Again, good to see you in the chair. I would like to thank the member for Mid-Ulster for securing this adjournment debate. It is welcome the importance of domiciliary care is highlighted through this being the first adjournment debate of this mandate. We all have constituents who need care. We all have constituents that have carers and families that are impacted by caring responsibilities. Mr Speaker, domiciliary care work is very important and seriously undervalued part of Northern Ireland health and social care system, and we have heard that again and again today. Our carers and nurses provide invaluable care to individuals within their own homes, and it is right that this Assembly and the Department does what they can to support them. The Alliance Party position on domiciliary care is outlined in our policy document Fighting Fit. In particular, we want to see improved pay and conditions for those in domiciliary care, similar to what had been highlighted by previous contributors, to encourage more domiciliary carers and district nurses to be able to continue working within the sector. More specialised training and pathways enabling longer stays, particularly to counter loneliness among the older population, and to give more time to identify any potential mental or physical health risks. That is something that when people come into their homes that they're able to pick up on, and this can prevent future hospital admissions and get on top of things very, very quickly. It is also essential that care staff who visit homes have adequate equipment, as again has been raised by one of the members there as well. A sustainable domiciliary care system is important for the entire flow of patients throughout our hospitals. This has been reiterated several times, and it is leading, as we know, this is leading to overcrowding in hospitals, which is a public health risk. I've seen myself many times. Bengal highlighted the perfect storm in which the entire health and social care system faces, with patients admitted to hospital unnecessarily because they can't access treatment they need in their communities, to patients being forced to stay longer than they need in hospital because of the absence of domiciliary care packages to support them at home. This increases pressure on hospital beds, emergency departments and health and social care staff. More recently, the RQIA System Inspection Report of the Southern Trust highlighted the importance of a sustainable domiciliary care sector, particularly the need to encourage more carers and nurses to consider working within the sector, since currently we are facing an unprecedented number of unallocated domiciliary care packages, and I recognise the number the member alluded to earlier on. As an MLA whose constituency largely coincides with the Northern Trust, I welcome the focus of this debate being on the Northern Trust and the pressures faced there in particular. One of the advantages of domiciliary care packages that are supporting individuals within their own home means we can lessen the pressures on our main hospitals and reduce waiting times. We have seen this work effectively within the Northern Trust. An example, following a survey of domiciliary care workers in the Northern Trust in September 2022, 4,979 people in the Trust received approximately 12 hours of care and 27 visits. Now, although I note the 1,700 people that was mentioned who are waiting care packages, these do play a small role in alleviating hospital stays and hospital waiting times. And certainly it's my experience that for people's mental health and well-being, they would much rather be cared for at home, if possible. It is worth noting that in the Northern Trust, you have both the highest percentage of patients waiting under 13 weeks for an inpatient or a day case treatment and the lowest percentage waiting over 52 weeks. So it shows you that obviously while there is still an amount of people who are waiting care, that when we do provide the care, it does impact those waiting lists. Finally, I do want to discuss the proposal of domiciliary care charges and particularly the revenue-raising proposals from the Secretary of State. The Department of Health had previously considered proposals to introduce charges for domiciliary care, for example in the 2016 report Power to the People, which highlights the charging arrangements should be equitable and based on the principle that a person should be able to contribute, should pay if they can afford to contribute to do so. As a party, we objected to the Secretary of State's consultation on introducing domiciliary care charges, as this should be a decision for a locally elected and accountable Assembly and Executive. In fact, many of the issues facing our health and social care system have been exacerbated over the last 2 years by the absence of this Assembly and the Executive. It is important that any proposals are debated and scrutinised here and in the Health Committee, but our priority should not be on charges, it should be on how we reform and improve domiciliary care, and this should be the focus of this Assembly and this Health Committee. So I do welcome this debate. Thank you very much.
And I call Steve Aiken.
Thank you, Mr. Deputy Speaker, and may I wish you all the best in the chair. Mr. Deputy Speaker, Northern Ireland is not unique in experiencing rapidly changing population demographics. As a society, we are facing rising demand for adult social care services. The number of older people, the group most likely to need social care, is rising faster than the population as a whole, and this is something that will cause some quite profound challenges in the decades that lie ahead. Indeed, over the next 20 years, it has been estimated that the number of domiciliary care recipients is likely to need to almost double. It is inevitable, therefore, that increased funding will be required to meet the rising demands created by these pressures alone. And whilst there may be a huge capacity challenge coming down the track, the reality is that there's already a big shortfall. As has been said, the Northern Trust is one of the largest trusts, but it also has one of the largest and oldest populations. As such, when there are pressures facing adult social care, those challenges will be especially felt in the Northern Trust area. Every MLA, especially those in the Northern Trust area, are likely to have worked with many families as they wait for a care package for a loved one. And it's my understanding that the greatest level of unmet need, both for full and partial packages, is within our trust area. The reality is care packages are absolutely critical in allowing people to remain in their home or return back to their home after a spell in hospital. So when there are challenges in providing places as they currently are, the impacts are often immediately felt within hospital settings as discharges are delayed. And as we all know, hospital stays are far from ideal for older people who don't medically need to be there. There is no easy solution to this. But one thing that is critical to the sustainable provision of care moving forward will be a stable workforce. So that is why it is important that we all commit to improving the pay, terms and conditions for the social care workforce. It is a hugely important sector, and it is clear that there's still more we can do to support and promote it as a career. And even beyond the more formal care providers, it's important that we also don't overlook the vital role played by informal and our family carers. There are more than 200,000 people across Northern Ireland providing some form of unpaid care, and this number will rise in the coming years as the populations continue to age. Thank you, Mr. Deputy Speaker.
And now I call Cara Hunter.
And just to congratulate you, of course, in your role as Chair. And also just to put on record my congratulations to the Minister who has been reappointed to his position, and we wish him well. I'd also like to place my thanks for the member from Mid-Ulster for holding this important debate here today as well. And I acknowledge the many difficulties and challenges, Minister, that you'll have undoubtedly in the coming months, and I think it's really important that we're here today to discuss this, as it's one that has faced so many of our constituents, and certainly in my time as MLA I've come across, just like the previous speaker, Mr Patsy McGlone, has touched on, hundreds of families that are unbelievably impacted by this issue. And I'd just like to raise one of their stories. I have a constituent called DJ Calvert. You might have heard his story. He's based in Portstewart, and DJ is just an absolute gentleman in every sense of the word. And he was born without hands or legs, and he was told months ago, of course, that he would no longer have access to a care package and a care worker. DJ requires a care worker to help him shower and to get dressed, and those are two key things that each of us do each and every day. So I really can't imagine genuinely how he must have felt when he was told that this was potentially going to be taken away. DJ's fear that this would then force him to move into a care home, and in his own words, he had touched on that this shows the social care system was failing. Thankfully now, DJ has been told he will get a care package, that it has been sourced and that will allow him to continue to live life independently within his own home. And that's really a huge part of this, getting people the right care that they need to live high quality lives that they so rightfully deserve out of hospital and of course in the comfort of their own homes. And this is a good news story, but for so many others, as mentioned around this chamber, it doesn't always end up the way that we want. And this is an issue, I cover both the Northern and the Western Trust. This is an issue that far surpasses just the Northern Trusts and the Western Trust as well, specifically in rural areas like Limavady, Greysteel, Feeney and Claudy. And I like my colleague, Mr McGlone, who raised this previously. There really is a rural dynamic to this and the challenges and getting care workers out into those communities. So that's a real challenge. And I just want to touch on the importance of supporting our carers as well, who are so selfless. And I too have had the experience of, with my own grandparents when they were alive, just seeing the role that the carers do play when they're in place and the challenges that are there, that exist within families and family dynamics within the home when the care packages really aren't there. And I really need to highlight that this is about quality of life and it's about dignity as well. And one of the speakers had touched on their respite services. They're truly in crisis. I'm working with a family at the minute who have been waiting months for support, so I just have to put on record as well the real crisis within that area. Minister, I know this is an issue that you do care about, and I'm asking today if you can do all you can to engage with the Trust on this issue to ensure that no one suffers the indignity and the uncertainty of life without access to a care package. Thank you.
Now calling Paul Frew.
Congratulate you on your role. This is a very important subject. It's a very touching subject, and I'm so glad that the contributors have spoken about the most important element of this, and that is people. Nearly every single one of us have spoken about people. The people who receive the care, and then the people who administer the care. And it takes a special type of person, Mr. Deputy Speaker, to go into somebody's private home and administer intimate care to a person who could well be in the twilight of their life, or who well could be so severely disabled, no matter what age, that it is hard for them to live. So it takes a special type of person. But it is also true to say, as has been mentioned here today, that those people, special as they are so undervalued. And it should drive a stake in our hearts with regards to how undervalued they are. Every single policy direction that the Department of Health have taken around health and care has been to keep people at home. And that's all well and good. But if you can't support those people, you create further casualty, you create further ill health, and you increase the numbers of people who then need care. The burden on families when you have a sick relative at home not getting the care that they require is absolutely mighty. It is strangling, and it can destroy family relationships, not just with the principal patient, but with siblings and others. And it can poison a family relationship forever, even when that principal care is gone. And so, if the drive is, and I'm not saying it's the wrong drive, to keep people at home longer, then we really need to do better at investing in the right places. And whilst the health service needs dramatic reform, in more ways than one, it strikes me that this is one of the easiest areas to reform, because it's all about people. Mr. Deputy Speaker, when I first became an MLA in 2010, it was clear then that for someone living in a high area or a countryside area like Newton Crumlin or Glenmoray, it was very difficult to get a care package even then. But here we are in 2024, and you're struggling now to get a care package for villages like Bershane and Kells. So that rot has crept right down into lowlands and into population centres. So there's something dramatically wrong or going wrong. And it strikes me this is one of the easiest ways to reform, because it's people and because in many ways it's simple. Pay these people what they deserve and what they require, make sure their terms and conditions are appropriate, and make sure they get decent travel allowance, because they're the ones driving up lanes that are miles long in all weather to get to that patient. And we can all realise that to pay them appropriately is still going to be a lot cheaper than those people in a hospital setting or bed. I have one case, Mr. Deputy Speaker and Minister. Only last week it came to my attention that there has been an elderly gentleman who has been in hospital for 12 weeks when he shouldn't have been. And that condition and that man's ailment was a broken ankle. 12 weeks for a broken ankle. Now, think of the repercussions that has right throughout the health service. And that's the reason why other systems within our health service are failing. So fix this at the very top, which is people at home, caring for people at home, and you will go some way to fixing some of the other ills that are invested in our health service. And that way, the only way, Mr. Deputy Speaker, is to pay these people appropriately, to make sure their terms and conditions are solid, and to make sure they get the travelling allowance that means that they can travel about the country that we ask them to do and care for these people that we so love. Thank you.
And I now call Saoirse Eastwood.
Thank you, Mr. Deputy Speaker, and I really want to commend the member for Mid Ulster for bringing this adjournment debate today. It's incredibly important. This is something I am really passionate about, and I'm looking at you immediately, Minister, and I'm eyeballing you, because for me, this is one of the absolutely crucial issues. We discussed yesterday in this chamber the issue of childcare, and I'm sure we would all agree after that debate that we should regard health and social care as key, critical economic and social infrastructure. A number of members have referenced the fact that the people who engage in this work are incredibly special and are incredibly talented, but we as a society need to get real and need to get absolutely serious about valuing these jobs. I sit in the Economy Committee, and I do have to admit that I'm not in the Health Committee, but I do have an absolute passion to make sure that Northern Ireland can adequately resource the workforce that it needs. And at this point in time, I am not convinced that we are grasping the metal in terms of what we need to do to make sure that we are actually preparing ourselves for the future. Absolutely, we need to look at terms and conditions. We need to make sure people in post currently are paid. But what I want to see is actually getting to the core of the problem. And if we're not creating the workforce that we need for the future today, we're going to continue going on in this circle. Apprenticeships is something that I have previously had correspondence with the Minister about in the outgoing mandate, and I know that public sector apprenticeships are something that are absolutely key in terms of looking at this going forward in terms of the trust side of things. But as the member, Patsy McGlow, has also referenced, there is a huge and burgeoning private and independent sector. For me, this is something that gets to the very heart of what it means to have genuine cross-departmental working. And we have the skills strategy, we have regular briefings about the importance of IT, about the importance of agri-food, and absolutely, those are key to Northern Ireland's economy going forward, and we absolutely need to do work in those sectors. But what I don't hear, and this is a challenge to us all, but what I don't hear is that health and social care is actually playing a huge part of where we need to be in the future. We need to encourage our young people, people who are mid-career, people who want to transition, that if you get into this sector and if you work in this sector, you will be valued, and not just for you as an individual, but for your contribution to the economy and society and families and people's lives at large. I created an all-party group on skills whenever the House was down, and obviously that will now go through a process to be constituted formally. But one of the first events we will be doing in April, and an invite will be sent to all members, will be looking at the matter of skills and health and social care. And we cannot keep fooling ourselves that if we simply address the issue of paying conditions, which in itself is innately difficult to do because we don't have a bottomless pot of money, we will be fooling ourselves if we don't put plans in place now for how we need to resource this. I would be calling on the Minister today to properly have a joined-up plan that goes much further than the skills strategy, but ensures that the Department of Health and the Department for the Economy are actually taking this issue seriously insofar as having a very clear timeline in terms of what we need to do. This could apply anywhere in terms of medicine and health and social care. But unless we actually have the conversations today and do it in a way where we're looking to the Economy Minister as well as the Health Minister, we're not going to be able to do it in isolation, and we're not able to do it alone. But I would be calling on the Health Minister today to hold our feet to the fire in the Economy Committee and the Economy Minister, and indeed everybody who cares about the future of this place, because we will have his full support in pushing that open door. And I want to make sure that we actually continue to have these discussions. And I just want to reiterate again my support to the member for Mid-Ulster for bringing this to the House. And I hope that we have more of these discussions in future. Thank you, Deputy Speaker.
I now call my South Antrim colleague Pam Cameron, but Pam, we're going to be limited to 4 minutes. I hope that's okay with you.
Speaker, I'm delighted to get 4 minutes. Didn't think I'd get much time at all, so thank you for allowing me to squeeze in. And I'm glad this debate has been so well filled that you are actually running out of time. I think it's very welcome. First of all, I could say congratulations on your new role, and to my other South Antrim colleague, Mr Aiken, on his new role as well. And welcome back our Minister of Health as well, who I've worked with. No, not my South Antrim colleague. Not yet. Mr Deputy Speaker, I'm not quite ready to welcome Robin in that capacity into South Antrim, so I'm sure you'll forgive me if I refrain from that. But I thank also Ms Sharon for bringing this debate to the Chamber, a really important debate which we are all agreed on, and the incredible need there is to sort this issue out. Domiciliary carers are so valued, but yet not, because it's not reflected in their wages, their terms, their conditions of work, and that has to be addressed, and I trust that the Minister will seriously look at that. There are obviously lots of other contributing factors to this whole issue, and I don't want to forget the need to look at the entire issues, and that I would also suggest would include the preventative measures to stop people actually getting to that front door of the hospital. And I'm thinking in terms of GP services, and thinking in terms of the investment in community pharmacy, all those things where they may seem small, but they're actually vital to keep people away from the hospital door. That's what we want. And then, of course, we need to get people out the back door of the hospital, to allow the people who are acutely sick to enter the hospital, and that is of vital importance. So we need to assist that and ensure that those who do not require acute care in hospital are able to leave and go home, or go to an appropriate setting to enable them to recover without actually taking up that space in the hospital that's not actually needed. And we know that hospitals are not the best places for people who simply need to convalesce and who should be home, or should be in a step-down facility, or in a home, or with relatives. We know that's not the appropriate place for them. We want them to see them into the right place. So we really do need that to happen. And I agree with all the points that have been echoed in this chamber this afternoon. And the lack of affordable childcare is a massive issue. Massive issue. So, and in particular with women, because women tend to be the carers, whether that's for babies and children, or you're actually giving birth and trying to manage work and juggle family life, or whether that's for elderly parents and relatives. It does tend to be a female workforce. It's also a female workforce that are going out to do the domiciliary care work on the whole. Obviously there will be males employed as well, but it's vitally important that we do support women to stay in the workplace. And yes, while we're all I think, agree that everybody wants to remain at home for as long as possible in their lifetime with the appropriate care. It's not always the best thing. It's not always the best thing for family members, and quite often we have to look at the bigger scenario and actually look at who may become the carers of these elderly people that we love. And quite often that is healthcare professionals that you're taking out of the workplace then to care for their loved ones. So it is a real conundrum which will need a lot of efforts across the board to actually solve the problems that we have. We all have regular meetings with Jennifer Welsh and the Northern Trust, and we know how hard the Trust work to try and deal with this problem, but it is a huge problem and they do need the proper resource in order to deal with that. And we also have to recognise that Northern Trust do have a very high percentage of elderly population, which puts a greater burden of care onto that group. I'm aware that I've used all my time, and I thank you, Deputy Speaker, for allowing me to squeeze in the last, and I wish the Minister well with addressing this problem. Thank you.
And I thank you for your opening comments as well. I'm sure the House will join with me in extending to you our best wishes for your new role as Junior Minister. Well done. I now call on the Minister of Health to respond.
Thank you, Mr Deputy Speaker, and thank you for the opportunity, members, to respond to the important points that have been raised this afternoon, and can I thank the member for bringing this adjournment debate the first of this session. But Mr Deputy Speaker, can I thank also everybody who has attended and contributed to this adjournment debate. I've attended many adjournment debates as Minister of Health with usually 3 or 4 MLAs from that specific constituency, but I think the topic today has engendered that wider contribution, not just from the Northern Trust, but we've had input from another number of other trusts as well. Because in common with all our health and social care trusts, I'm aware that the challenges that the Northern Trust has experienced in securing that capacity to meet the increased demand for domiciliary care is shared across the piece. The Trust has reviewed systems with their in-house home care service in order to improve efficiency and to deliver higher levels of face-to-face time with the service users. And as has been referenced, Ms Cameron just raised it there in her closing comments, the Northern Trust actually covers a quarter of the population of Northern Ireland, but it also includes over 27% of the region's people who are over 75, so it does cover that wider section that does require domiciliary care. And it's that population base that generates the majority of demand for unscheduled care and community services. But as Mr Aiken referred in his contribution, demographics are also an important consideration, and this cohort of the population has actually grown by 17% over the past 5 years. So as a result of that, the Northern Trust has experienced unprecedented levels of demand actually across a range of services. And unfortunately, as has been raised, I'm advised that the Trust is seeing an increased trend in a number of those external providers who are now handing back services due to their inability to, as has been mentioned by many speakers, to actually recruit and retain staff. So an area particularly impacted by the recruitment and retention of staff is the Mid-Ulster locality, and I'm aware that a number of members have engaged directly with the Northern Trust on behalf of their constituents, and it was, I think, telling by the passion of Ms Sheeran in her opening comments, but not just her passion, but the understanding of the need of the people who are coming forward to domiciliary care, but the people who are working with it. And Mr Speaker, Deputy Speaker, I don't do this without thinking about it. For a constituency MLA for the Northern Trust, I think the engagement that we get from the top down in regards to the Chief Executive in dealing with these cases and supporting that, I think it is an exemplar to other trusts as well when we heard the challenges they are. It doesn't come as a solution to everything that they need or that we want. I can advise members, and as Mr Buchanan referred to, I've already responded to him in writing, that the Northern Trust has commenced a contract with a new independent sector provider for the Mid-Ulster area, and the Trust anticipates that this will increase capacity in this locality. And as has been said, the Trust has contracts with 22 independent sector providers, which includes 3 new providers who have signed contracts in the last year. So that's a positive step. But I do accept that more needs to be done. It's important to note that the pressures and challenges faced by the Northern Trust in relation to the provision of domiciliary care packages are a regional issue, as I've said, that all 5 health and social care trusts are experiencing, and they experienced in the same factors. So we understand fully the many challenges resulting from demand for care packages, which currently outstrips the available supply. And that has the knock-on effect, as many members have referenced, in regards to being able to directly, in terms, that knock-on effect of delayed discharges from hospitals, the availability of our hospital beds, accessing domiciliary care packages for patients at the point of a hospital discharge remains a challenge for our health and social care trusts. But as other members have referenced, our health service in Northern Ireland is a circular system. So where the pressure comes in one point, it has that knock-on effect. But Mr Deputy Speaker, as has been referenced as well, there is no easy solution. Our staffing levels continue to be a significant challenge across health and social care, and particularly in the allocation and delivery of care packages. And clearly any increase in the number of care packages provided must also have the appropriate staffing levels commensurate with that additional provision.
Would the Minister agree, and there's a significant issue, is not just merely the pay that the staff get, in the sense that it's easy to say we need more money, but actually when you take the pay that they get and compare it to other jobs, there are other jobs where they won't be out of pocket, where they maybe are getting a few pound more across a shift, and they're doing jobs where there's less responsibilities, and that actually we may need to do some sort of scoping exercise that benchmarks the job of caring, allows us to value those carers and then pay them appropriately, and that might attract more into the sector.
I thank the member for his comment. I'll come on shortly in regards to the forum that is currently looking at that, something they initiated and something now is running within the department, just in regards to the 8 work streams that are currently being looked at. Because my officials continue to work to maximise that current capacity in social care, and actually to engage with the service providers in regard to addressing those ongoing issues of recruitment, but also retention. And that's only possible, I think, as Ms Eastwood said, with that skilled and dedicated domiciliary care force, because they also understand the importance of reward and recognition in the recruitment and retention of staff in this sector, because I'm cognizant of the ongoing challenges relating to increased costs of the day-to-day expenditure for providers. Mr Deputy Speaker, over 75% of home care provision is provided by the independent sector, and I want to place on record my sincere appreciation to those staff for the integral role that they play in health and social care. The system would simply not operate without their dedication and commitment. And indeed, I recognise the need for action to support the sector and those working in it. And I've stated that my immediate priority is to see pay negotiations taken forward and concluded without undue delay for our healthcare workers in the statutory sector. Certainly.
I would just like you to assure the House that you will indeed look at areas and treat all our areas fairly when you're looking at the bigger picture. Thank you.
Certainly, and I thank the member for his contribution, and I think that's when a reference, in regards to the interest in this topic for what is an adjournment debate. I think it shows the passion and the commitment that we all have as elected representatives. Mr Deputy Speaker, in 23-24, the regional domiciliary care rate paid to the independent sector providers actually increased to $18.54 per hour. So work is currently ongoing to consider what the regional rate for 24-25 will look like. So whilst my department cannot actually mandate the rate of pay or terms and conditions offered by the independent sector providers to their employees, any uplift to the rate would be expected, and I would expect it to be reflected in the pay or terms and conditions of their staff. Members, I think in the contributions it really is time now actually to look forward and to look at how we can meaningfully affect that positive change and improvements in the social care sector in Northern Ireland. And I'm pleased to advise, as I've said, that good work already underway, I believe, will help to achieve these aims. And to that end, as I referred to the other previous intervention, members may be aware in 2023 my department established a social care collaborative forum, the purpose of which is to provide a formal mechanism for the department and representatives of social care across the sector, across the statutory, across voluntary and community and private sectors, actually to work together as partners to build shared values and actually deliver improvements in social care. And a number of work streams have been established across a range of issues that have come forward from the forum. And just so members are aware of those 8 work streams, one looks at maximising capacity. There's a further one that actually looks at workforce development, which I think many members in here referred to today. There's enhancing care in care homes, because it all is part of an integral system. There's a work stream on data research and evidence, so that anything comes forward comes actually with that experience as well. There's one on communications, because as we've all seen as constituency representatives, that communication between health trusts, between families, between carers is vitally important in how we ensure that people are content that the support that they need is actually there. There's also a work stream that will look at commissioning and contracting, because we are cognizant in regards of that mix between independent providers and our statutory system as well. Work stream 7 looks at the role of carers, which has been mentioned around the House today, and the last one is actually in supported living. And I think that goes back to Mr Frew's point in regards to that move to be able to support people in the House. So, Mr Deputy Speaker, in conclusion, while there are a range of factors which can impact upon the delivery of care, the key objective that we should all be looking to should be to meet the assessed needs of the service user, whether care is provided by the statutory or independent sector. And I would recognise the importance of ensuring that patients can receive the right care at the right time in the right place. And I can assure all members that my department will continue to work in partnership with all relevant stakeholders to progress plans for these vital services. Thank you.
I thank the Minister for that response. The Assembly is adjourned.